Hello and welcome to today's Let's Talk About Health webinar. I'd like to introduce your moderator for today, Donna Jacobs. Donna, you now have the floor.
Good afternoon, Dave. Thank you so much. And good afternoon, everyone. Welcome. So pleased to have you join us today for the University of Maryland Medical System's Community Conversation Series, Let's Talk About Health. As Dave said, I'm Donna Jacobs, and I will moderate today's program. The Let's Talk About Health series is devoted to help the community do three things: gain more awareness about a wide range of health topics, and we've spoken about many of those over the past few months, to improve and maintain individual health and the health of our families, and to create better, more robust conversations with medical providers when we're there. So often we leave the office and realize we're not understanding all that we wish we could or should. So today's topic today is post-traumatic stress disorder, which is commonly referred to by very many as PTSD, and that's a term you might have heard quite often. Presenting today is Dr. Connie Knoll. Dr. Knoll is a psychiatric nurse practitioner, and she works at the University of Maryland Upper Chesapeake Health System in the Behavioral Health Unit. She's the chair of the Recovery Council of the American Psychiatric Nurses Association. She served for years as a psychiatric nurse in a variety of administrative and teaching roles. I first met her when she was part of the American Red Cross as a mental health volunteer. And I have to tell you, on a personal basis, I was so impressed by her work and even perhaps more importantly, her discussion about her work following her deployments to situations such as the Oklahoma bombing site in 1995, 9/11, where she worked both in Shanksville, Pennsylvania, and in New York City, among others. But perhaps of all of those, the most impactful one to me were was her work and her stories about her work following Hurricane Katrina. I was particularly struck by her innate understanding, compassion, and cultural sensitivity. And that's been important to me in terms of our friendship for a really long time. Our personal conversations since then have been consistently engaging, inspiring, and uplifting. Dr. Knoll is a repeat presenter at webinars like this, and I'm really delighted that she's here to talk to you today because she shares in such a compassionate way. Before I turn the microphone over to her, though, a few housekeeping items. Although this is virtual, these conversations are meant to be transactional and interactive. Therefore, as Dave said, please feel free to write questions that you may have in the Q&A box. Just address them to everyone, and I will moderate those. We'll get through as many as we possibly can. And you can do that while she's speaking, and she's really happy to talk to you at the conclusion of her talk. We won't be able to talk about any specific medical conditions that maybe relate to you personally, but certainly she's very happy to speak in a general way to our listening audience today. And also, as Dave said, this session is being recorded and it will be available to you together with her slides in just a few days. I'll come back to that at the conclusion of all of this. And I think with that, Dr. Knoll, we're ready. I think I have one more slide. Next slide. So we have framed all of these sessions in the Ask Me Three context. And by that, I mean three questions that you should bear in mind when speaking to a medical professional. And it really helps you retain the information that you're given and to be sure that you get the right information from your visit. So three questions. And as Dr. Knoll moves forward, you'll hear her frame some scenarios in terms of these conversations, and that should be helpful to you. Three questions. What is my main concern or my problem? Make sure you understand what the issue is. What do I need to do about it? And why is it important for me to do that? Oftentimes people are given specific instructions or medications, and it's easy to forget that. So you want to lead with that kind of information. Dr. Knoll, the floor is yours.
Well, I'd like to thank you, Donna, for such an eloquent and wonderful introduction. I really consider it to be a privilege to be here this morning and to be able to engage in a community conversation about something as timely as the pandemic era trauma and PTSD. Could I have the next slide, please? So I don't need to say how much unprecedented stressors we've had in the past 2+ years. In terms of the pandemic, there has been the quarantine issues, isolation, being at home, not being at home, stops and starts with availability of equipment, testing, test sites, vaccine, people who refuse to adhere to what the preventative measures have been stated to be, dealing with waves of high COVID occurrence and illness, hospitalizations. In addition to that, there's also people who have been dealing directly with having symptoms, being ill, dealing with deaths in their family, long-term COVID. And then there's also been a general sense of loss of what previously had seemed normal and not being able to return to some semblance of that, although this current lull, if you will, has offered the opportunity to have the most return to normal. But in addition to that, over the past 2 years, I can't negate the fact that we've had such social unrest and such divisiveness in the country that has shown such openness with hate groups and an overall increase in local violence and incivility. And then most recently, there has been, with Russia invading the Ukraine, there's now a sense of, there's a major war in the world. What the response to that is having uncertainties, which added to supply strain, which add to financial stressors. So there's just an abundance of unprecedented stress that people have been dealing with. And what I really want to address today is some of how do we look at those things and what you can do. Can I have the next slide, please? So in looking at the issue of what has happened with mental health in this pandemic era, most recently, the World Health Organization, or WHO, in March just published that the pandemic triggered a 25% increase in anxiety and depression worldwide. Now, one of the things I want to say right in the beginning here is that anxiety and depression can be both a state and an illness. And for the intent of this presentation, I'm going to talk about these as states. And I'm going to talk about PTSD as an illness. So some of the other findings about mental health is that there's been other studies that have shown that there's been an increase in mental health symptoms and that there's been some resilience during the pandemic. Now, specifically to PTSD in the general population, it's really well worth noting that fear of contracting the virus, as well as taking measures to counteract the spread of infection, both have been perceived as traumatic events. And the other thing that is shown early is that COVID did bring a sharp increase in the diagnosis of PTSD. It was increased by 15%. So can I have the next slide, please? The other thing that has been well established during the pandemic, and also I think associated with some of the events associated with civil unrest, is that the disparities that exist and inequities, most often to the people who are most oppressed and marginalized in society, were magnified. Many times in the beginning of the pandemic, we heard statements like, we're all in the same boat. And I think the more accurate statement here is that we were all in the same storm, but we weren't necessarily in the same boat. There are some people who had much more option, privilege, financial resources, and access to care than others. And the other thing we know about mental health and health disparities is that mental illness is particularly affected by what we call the social determinants of health, such as racism, discrimination, and adverse childhood experiences, unemployment, and food insecurity. So all of these things made for quite a storm that we have actually weathered in the past 2 years. Can I have the next slide, please? So let's talk a little bit about differentiating between stress, trauma, and what makes PTSD. First, I'm going to talk about stress in the sense that stress is something that can be disruptive, but it's also a normal reaction and something that your body is designed to do so that you can adjust to new situations. Stress can be positive. It makes you more alert. It can increase your motivation, and the historical survival skill of stress is that it allows you to avoid danger. You've heard the phrase fight or flight. That is one of our survival techniques as a species, and it is important to know that it's what our body was designed to do so that we can move forward in a different way. Stress can be long-term or short-term, and it can become a problem if there are stressors that just continue and there's not any relief or periods of relaxation. Can I have the next slide, please? Okay, trauma is distinguished from stress in that it is usually thought of as an event that is catastrophic, and it has the impact of feeling like your life is at risk. It can be a man-made thing, it can be a natural thing, it can be the reaction to the death of a loved one, it can be the reaction of a violent event. It can occur through witnessing those events, even if you are not directly involved. Now, there aren't too many people that live their life without any kind of trauma. So, in thinking about this, if you think about your own life, there are probably things that happen to you in your life where you think of things as before that event and after that event. A very common traumatic event is the death of a loved one, which because of the nature of human existence, we all deal with at some point or another. But there are other things. The other things that I want to say about trauma, it is not necessarily the event that causes problems. It's actually what you do. And there are people who have lived through and survived and thrived through horrendous events. And you would never imagine if you saw them and they were functioning that they had lived through such events. So some people deal with trauma much, much more than others, but we are all affected by trauma at some point in our lives. Can I have the next slide, please? So let's talk a little bit about what's the difference between stress and trauma. So stress is, as I said before, somewhat of a reaction where you may feel tense, You may have a feeling of your heart racing, chest heaviness or tightness. You can have problems with focusing. Very commonly, people have GI distress. Um, Pain is also affected by stress. So people have increased pain, increased headaches. One of the things that is important to understand is that your body will react with a physical problem more than a mental problem first. So that's why you get these increases in these kinds of body symptoms when you're exposed to stress. Other things you could notice is things like clenching your jaw, teeth grinding, noticing you're clasping your hands in a tight fist, white knuckles, feeling less energy, feeling drained, having trouble sleeping, maybe some unusual dreams. And then very often people get a cold or have some other kind of infection because all this decreased sleep, bodily problems, less energy, it weakens your immune system, and it does make you more vulnerable to infection, which is particularly significant in thinking about times of COVID. We have had many people, patients that I treat and colleagues, feeling differently when they come down with a sniffle. Because is this the beginning of a COVID symptom, or do I have a common cold, or am I having allergies? All those things were more prominent during this era. Now, trauma, on the other hand, you may feel like you're in shock, or you may feel there's a sense of disbelief. You may find yourself wanting to believe that it's not happening. It's beyond just difficulty concentrating to a point of feeling confused about what you might need to do, having some significant mood swings, having fear and anxiety to the extent that you may feel like you're paralyzed to act or function well. You could feel full of guilt or self-blame in terms of COVID in families. Why does one member come down with it and others don't? Why do some get very sick and others don't? There is something called survivor's guilt with traumatic events, and it is a real thing that is hard to deal with. I think one of the hallmarks of trauma is that, again, that feeling of numbness or feeling disconnected. And one of the things that you could think about in terms of a progression of stress symptoms to the point of trauma is if you feel like you can't feel anything anymore, that sense of numbness that happens. Can I have the next slide, please? So now let's talk a little bit about a mental illness that is PTSD, post-traumatic stress syndrome disorder. And this is characterized by extremely negative memories, flashbacks, nightmares. Heightened arousal means that you're checking things in a different way, or you feel like you have to be hypervigilant about avoiding certain things that may trigger these memories. One of the things to think about in terms of this, in terms of it being a diagnosis, is that it is not diagnosed in the first 30 days after a traumatic event. In that time period, you would, if you were having extreme reactions or some of the things that I've talked about, you most likely would be thought to have an acute stress reaction or acute stress disorder. But after it lasts for longer than 30 days, and that would be 30 days of having a lot of trouble functioning, you might have post-traumatic stress disorder. But there's also some criteria that have to be met that a clinician who would be assessing you would be looking for in terms of making this an accurate diagnosis. And those are things that you would have the exposure to a traumatic event. You would have an inability to stop these memories, flashbacks from occurring. And you would constantly feel vulnerable that anything could set you off and remind you of it, and you'd get to that numb place where you feel like you couldn't function. That can lead to avoiding things so that you're trying to avoid the triggers, and that would be to the point where you're restricting your usual activities in order to avoid the triggers. You'd have an inability to enjoy things, decreased interest, worsening sadness and anxiety with problems focusing, having attention problems, more irritability, feeling aggression, startle responses, and as I mentioned, the checking behaviors. Now, the other thing that you have to meet the criteria for this is that these symptoms would affect your ability to function in two areas of your life. So generally, these are thought of as your home life and your work or school life, or your any productive life outside the home. It's a little different if you are a stay-at-home mom or dad who is a homemaker, because then your home life and your work life are intertwined in a unique way. But you would think of having these symptoms affect you in a way where you are unable to function at work and deteriorating and unable to function well at home, both of those. So now I just want to preface this as when we talk about these symptoms, it is very typical to say, oh, well, I have that, I have that, I have that. Maybe I'm really in trouble. So let's have the next slide. So let's use the first ask me 3. So let's say you've noticed that sometimes you can't sleep, sometimes you feel irritable, you cry more easily, and you feel sometimes like you can't get through the day. Now, if this has happened infrequently or just occasionally, or if you feel as though you can't function, even though you are functioning, you're probably experiencing a pandemic type of the constant barrage of stress. You're having normal reactions to what feels like episodic high stress. In other words, you have these waves of stress keep occurring. So what do you need to do if this is happening to you? Well, and we're going to talk about this momentarily. We're going to start to think about taking an inventory of yourself and your ability to function. You can ask those you trust for feedback and be open to their opinions. And very importantly, you're going to develop, or you're going to increase your ability to have a plan on how do I get through this moment of feeling terrible stress or trauma. You're going to come up with a plan to come up with an idea of how I'm going to get through this morning or this afternoon or this day or this week or this month. But you may start out with, how do I get through this moment of feeling like this? And then seeking professional help if you have what I would call safety issues, which is you have a thought that you might want to harm yourself. You don't care about what happens to yourself anymore. You don't care about what happens to your loved ones. That's a red flag that you need some professional help. And why is it important to do this? Well, our perceptions of ourselves can be inaccurate in the sense, are you too hard on yourself? Or on the other end of the continuum, are you not realizing how far you've come from your usual self like how you function, how you think of yourself in terms of this is my normal self or this isn't my normal self. Okay, so let's talk about this a little bit further. Can I have the next slide, please? Okay, so I'm going to start with a story. I had the real privilege. If you remember when the pilot, Sully Sullenberger, landed a plane on the Hudson River, it was called the Miracle on the Hudson. And he and that flight crew that you see there landed a plane in the Hudson River in cold weather, and everyone survived. Now, I had the extreme privilege of hearing his co-pilot speak at a disaster conference once. And I want to say that the co-pilot said a couple things which really have stuck with me all these years. One was that he and Sully actually talked about the fact they had never driven a water plane, or, you know, the planes that land in water. They had never done that, and they always wanted to do that. I thought that was just an extremely interesting coincidence. The other thing is that when the things went awry on the plane, they had a manual that was about this thick. Let's see if I can get myself in there. They had a manual that was about this thick of how to deal with different catastrophic events. The manual was this thick, and they had 90 seconds before the plane was going to impact the water to decide what to do. And the pilot, he used all of his knowledge, skills, and experience, and he followed his instincts. And somehow he landed that plane as if he was landing on a runway. Now, one of the things that you probably may not have heard, now if you notice the back of that plane, it's down in that water. It took a while for them to get all out on those wings of the plane. And the people in the back were up to here in water for a while. But that crew led people calmly through the first moments of that. And the reason why I bring this up in terms of talking about surviving trauma is that the co-pilot had followed what happened to the people that were on the plane for some years. And unbelievably to me, some people got to the shore, took a cab to the nearest airport, got on a different plane that day, and went to their destination. Some people never got on a plane again. And one person, a young man who was so inspired by the pilot, has gone on to become a pilot. And the reason why I like to illustrate this story is because there are many variations of normal that can happen in response to trauma. And there may be some people who never got on the plane that now do fly. I don't know. But I use this story to illustrate how broad and varied a normal response to trauma can be. Can I have the next slide? So let's talk a little bit about reflecting on the past couple years. And I'll start with myself. And I will tell you a few things about myself and how I have learned to look back on it. One of the first things that I think about in sort of reviewing the past 2 years for myself is that I remembered how scared and frightened and fearful I was in the very beginning. Now that fear propelled me to do everything that I thought was in my absolute power to prevent. So I was going to the grocery store at 6 a.m. I had on 2 masks. I would bring home the groceries and wipe everything down. I would go early so I would avoid crowds. I was very meticulous about hand washing, not touching my face, all those things. Now, a few months later, I also would take my temperature a couple times a day because that was one of the early things that you could do to see if you were sick. It occurred to me a few months later that if I got up in the morning and I could smell my morning coffee, I probably didn't need to take my temperature. And I think that that's how I personally progressed, using every ounce of prevention I could and precautions I could in counting those small things that happened that allowed me to feel less tense and less afraid and more prepared to try to do normal things. In thinking about the past 2 years, I also started to think about when did I start to feel like I had survived this? And one of the questions I would throw out to this group for your own sort of internal review is, when did you start first feeling like you were surviving it? And when did you first feel like you had a normal morning or a more normal evening? What went into those things? And did you feel like you gained anything? So one of the things that I have commonly heard from patients and colleagues is that I've rethought about what's meaningful in my life. I've rethought about what I really want to do, what I can do. And I've tried some different things, and I've had some things that maybe not worked, but some things that really did. So I think these are important things. And I started with myself because I wanted to give you I don't want to come across to you as if I have all the answers, because I don't think anybody has all the answers. But I think that we can help each other. And I'm saying this to you in a conversational way so that you can begin to look at it in a different way, perhaps. Can I have the next slide? So have you had challenges? Well, very commonly in trying to get back together with family and friends, there's been conflicts and estrangements in families about beliefs, about political things, responses to the virus itself. It's been more difficult for some people because there is this high sense of divisiveness and conflicts that can come up. Now, equally, I do think I've seen, just to counteract that for a second, I have seen strangers being extraordinarily kind to each other as well. So it's not just a challenge. But you also may have had to deal with physical illness. For many, many people being out of work, there's been financial strain. There has been people who are having too much alcohol, use of marijuana and other recreational drugs, overeating and weight gain. All those things have been affected by the challenges in pandemic. And I also want to say that I'm speaking of challenges. There is another aspect that has to do with grief. If you've actually lost a loved one, or you're dealing with friends that you have lost. I have lost some friends and some more distant relatives, but I have been affected by this. So what is the sort of the antidote for the challenges? Well, thinking about what is in your control. What don't you have control of? And what can you do with the control that you have? And can you make some healthier choices? Thinking about, what do I need help with? And do I know where I can get help and support? Can I have the next slide, please? All right, so I talked a little bit earlier about vulnerabilities. There are some things that do make you more vulnerable to having PTSD, depression and anxiety as illnesses. And that is if you have a history of mental illness or you have a substance use disorder, that does make you more vulnerable. One of the things that's very important to do if you have is to make sure you stay in contact with your professional health and to make sure you take medications if they are ordered for you, and avoid substances because they're going to throw off your medicines and they're going to throw off you. Now, the next few things that are on this slide are there because living through dangerous events, having the experience of being hurt physically or emotionally, observing suffering, childhood events, all those things are traumatic. And as I said earlier, when you've had trauma, you can be re-triggered with trauma very easily. And it doesn't even have to be the same trauma that triggers you. Anything that feels traumatic may trigger old symptoms. Also, if you feel unsafe, that would be a red flag for professional help. And having limited social kinds of supports. It's been very hard to branch out and find new social opportunities in the pandemic. But some people have actually done that, and it can be navigated. So what are your strengths? What is your support network? If you have a terrible moment or you have a terrible morning, is there someone that you can call that afternoon or that evening? And you know that they're going to listen to you, they're going to hear you out, they're going to give you suggestions. Do you have people like that in your life? And if you don't have people like that in your life, how can you get them? I'm just offering that as a question without a definitive answer for right this second. The other thing is, have you had coping strategies that have worked in the past? Chances are you have. It's hard to think of those and do them again when you're feeling in a state of crisis, but remembering that you have survived other things will help propel you to survive what it is you're currently faced with. Have you responded effectively in the face of fear? Well, I think probably you have. And have you been able to establish safety? So recalling your previous successes or even partial successes is useful when you feel like you're in a crisis. Next slide, please. All right. So good self-care is key, and I put it at the bottom. It's really how you take your power back. And it really has to do with what goes into making you the very best person you can be every day. Well, there's a couple essential things. Sleep, good nutrition, and keeping yourself hydrated, having enough fluids, water a day, having exercise. Those are the key physical things to do to make sure that you're on the right way to stay healthy. Having meaningful activities, having fun activities, connecting with people, limiting news and electronics, and whatever spiritual practices you have. Some people would go to a pastor, would go to a church, a synagogue, a mosque. Other people might take a walk in the woods. Other people might like to look at the boats in the harbor. Whatever gives you a sense of pleasing peace is a good. Some people meditate. All those things are good. Being kind to yourself, trying to stay in the moment. Think about what your purpose is, what you want to accomplish, and what gives you joy. I will say I think there's a reason why that latest Adele song is so popular. It's because everybody wants to belt out the words, "Go easy on me." And they want to And I think you should think about that, saying it for yourself as well as wanting other people to do that for you. And that is something that you can do when you're stressed. Can I have the next slide? Now, why doesn't everybody do all this self-care and get on the path to being better and well all the time? Well, because there are some hard truths about self-care, in the sense that it could mean doing what you don't feel like doing. It can feel like it's really hard when you need to do these things the most. And some of it is that you have to let go of things that might feel really comfortable. Being honest with yourself is difficult. And other people can be disappointed or unhappy if you prioritize yourself. So those are things to navigate. And if you have trouble with this, I might urge you to think about adding a professional therapy in your life, so that you can get over the hump of what keeps you from being the best person you can be every day, especially if you have some habits that need to change. Can I have the next slide, please? So this slide gives you some suggestions to think about when you're feeling something, what you can do to check yourself or get yourself reoriented to get through that moment and get on the path for self-care and healthy things to overcome any kind of symptoms. And I like this idea. I get truth from lots of places, and I actually saw this pop up on Facebook the other day. But it says, flip the script. When you have a negative thought, try bringing 3 things to mind that are positive. Now, I had firsthand experience with this when I was in the Oklahoma situation. When I was dealing with people who had some vivid images of things, and we were teaching people, and I used it myself. When you have something that is very disturbing as a thought or an image, try flipping it to something that you've pre-planned to be recalling the most positive memory you have, or something you feel really proud of, or something that gives you a sense of feeling positive. So these are some suggestions of what you can do to flip those feelings into a piece of positive self-talk. Next slide, please. Then take some inventory of your successes. When did you feel less fearful? Do you remember the first time you laughed? Do you remember when you first had a sense of feeling calm, or like an overall sense of well-being? Have you accomplished things? Have you underestimated your accomplishments and what you have survived? And I would just think of what were those first meetings with your family or friends like? How good were those hugs? They were really good. I remember them well. Can I have the next slide, please? So let's look at this Ask Me 3. So if you're still afraid of falling apart, if you feel like there's some days when you can't deal with this, what are the things that you can do? Well, this could indicate that you're still having very strong emotions, reactions, symptoms, and the coping skills that you have used aren't working well. So what do you need to do if that's happening? The first question you should ask is, am I safe? If you don't feel like you're safe, I would really urge you to go to an emergency room, because that's where you can appropriately get an assessment. Other things, do I have someone I trust that I can talk to? Can I have a plan to get through this moment, this day, this afternoon? And then make sure you're making the healthiest choices, all those positive things that you do. And last but not least, connect with a professional if you need it. And why is this important? because all of you, all of us have value. Our lives are precious. We're important to our family and friends. I underline this and make this bold. Treatment does work. And it's possible that in another day, you won't have these thoughts and feelings. Next slide. And lastly, what I was going to say is that hope is a verb. There is always reason to have hope. There's always the possibility of positive growth and positive change. Crisis, trauma invites, in the most optimistic reframe, is that it invites the possibility of growth to be in a better place. And my final thought is that being kind is the most powerful, least costly, and underrated agent of human change. Next slide. Do we have questions?
We do. Thank you so much for that, Dr. Knoll. This has been great. There are several questions about whether or not this was posited all about COVID, and I responded in the chat that it was more than COVID, but it certainly, COVID has been the most current example that has impacted so many of us. But there are two questions that come in related to PTSD, but specific events that I'd like to throw out to you. One is there any particular advice that you might have for someone who is surviving PTSD as a result of combat, so post-combat PTSD?
There are a lot of military resources specific for PTSD that are usually available through the VA system. I would like to say this. Just as I would go back to the plane and those people on the wings and what happened to them. There are many variations. There are many degrees of the severity of PTSD. And I have heard of people doing really well with various professional ways of handling, like seeing a psychiatrist, going to therapy. But some people have gotten much better from like starting a musical group and playing the guitar or the drums every Friday night. So my overall message to that is that I would hope that your approach to and your strategies for handling this are very holistic, so that maybe do you need to rethink what gives you joy and what are the things that you perhaps regret not doing? Is it still possible to do some of them? Can you incorporate that with healthy living, good self-care, professional help? But I would emphasize that the approach is very holistic and multifaceted.
Thank you for that. Then there's another specific scenario which says, I was involved in a near-death accident, head-on collision 2 years ago. And anytime I drive by that place, I get flashbacks and I'm overcome with the fear of driving. How do I handle these situations? What kind of remedies might there be for me?
Well, I don't know if this person has sought any kind of professional help. I would say that if your experience of flashbacks is limited to driving by that particular scene, and it's something that you can realistically avoid, and that's the only trigger, then that might, that might work for you, but that is rather simplistic. I would go back to what you said at the beginning of this conference, which is specific answers to questions about what I can do specifically for my symptom is not something that I can really appropriately address. So I would again urge, if you have not seen professional help, you gauge how much this interferes with your functioning and go from there.
Two people have asked a similar thing, which is, does PTSD ever truly go away?
I know that there are, if you go to the SAMHSA website, the Substance Abuse and Mental Health Administration, you can find a wealth of stories from people who are surviving trauma, surviving symptoms, and living very productive, meaningful lives. If you go to those recovery sites, you'll see what goes into having a very holistic recovery plan. It's called a RAP. And the overall answer is yes. There are people who survive, thrive, and do amazing things despite trauma. There are others that have less success, and I don't think we should draw conclusions from those who've had less success, because I have seen many, many, many examples of people recovering and feeling very good about their lives.
Their questions are coming in like crazy right now, and we only have just a few more minutes, so I'm going to try to consolidate several, and then there are some resources that we're going to give you in just a few minutes that may answer some of those questions that are coming in. One of the questions is in a general way, which is, how do I get my family to understand what I really am going through and be supportive? And then the flip side of that is, how do I help somebody who may not want to articulate or really speak about what their issues are? And then something specific, again, back to post combat, which is, somebody says, I'm here to learn as much as I can to help my dad, a Vietnam vet. He's lost many comrades. He's not dealing with life well, even 50 years later. And my mom is trying hard. We're trying hard. So what kind of advice would you give for those who want to get support from their families or want to be supportive to their families?
So one of the hallmarks about dealing with family dynamics is understanding that you are really only able to change yourself. You can plant seeds and you can encourage, but you can't make someone else do what you think is the most appropriate thing for them to do. So I would advise, because we have a very brief time, if this is something that you're struggling with and it's causing a great deal of conflict, or it's affecting your ability to function, these would be signals that you may want to consider therapy, both to help yourself and to help you deal with family that you can't seem to get on the right track. And I would say, there's Al-Anon for people who have relatives with alcohol problems. There's those sorts of organizations and those sort of specific problems that are difficult. And just in terms of that last scenario with Vietnam vet 50 years later still having difficulties, that seems like a very classic indication that person needs help if they're having that much trouble. And 50 years later, there could be other things that are going on. So, I would say start with your primary care physicians and try to utilize going to the doctor to further evaluate any kind of medical need, or as a possible way to refer into a mental health professional referral. some of the things that you're describing sound like they're bordering on um, coping strategies that have long not worked. And if that's the case, I would urge people to seek treatment. And I would again emphasize that treatment really works. Sometimes it takes a long time. Sometimes you have to feel like you're matched well with a provider or a therapist. Sometimes it takes a longer time to get to the right medications and the right doses. But I can absolutely say that treatment works.
Let me just make a comment about some of the other questions that I see here, and then let's move to the resources which will help people. So someone asks, can PTSD show up 20 years later? I think we've just addressed that a little bit. And then there's someone who else says, can I find information about how to survive narcissistic abuse, childhood trauma, sexual abuse, and others? Let me say this. Let's go to the next slide. Let's take a look at some of the resources that we have available to you. And while I'm talking, you might grab your phones and just snap these next couple of slides to help you. But what we also will do is, and David, I'm talking to you, we'll keep these questions and try to address them as well. And I'll come back to that in a minute. Dr. Knoll, if you want to just mention these, we've got 60 seconds.
I've included a variety of kinds of links. Some are very they're very self-help oriented, particularly the top one and the bottom one. There are others that are trusted medical sites that give good explanations of stress, PTSD, and COVID. And there are a couple that are actual academic articles on some of the things that I've addressed and referenced in the talk.
All right, and the next slide. These are links particularly to help folks who are dealing with alcohol and substance abuse. Some are from the federal government, some are local. University of Maryland has a few programs that are here. There's one listed for Anne Arundel County, and then the National Council on Alcoholism and Drug Dependence, Maryland chapter as well. Let's have the next slide. So because it's 1 o'clock, we're going to stop here. I want everyone to know that if you would like to, some people asked, are the slides available? Is the presentation available? Yes, it is, and it'll be available to you in about 48 hours with all of the other sessions that we've had in our community conversations in the past. Those are all listed there. You'll be able to review this if you want and see it. It also goes on YouTube sometime later, and the place to find it would be www.umms.org/let's talk. So again, we will look at these additional questions that came in just in the last few minutes and try to provide you some help, and maybe look at some other additional resources that might be useful to people where they've asked for very specific information. I'm going to implore Dr. Knoll's assistance on that. Let me say, Dr. Knoll, thank you so much. There have been many comments that have come in that have said, this has been so helpful. Thank you. Want to see it again, want to think about it, may want to reach out. So very grateful to you to have presented this today. One more slide and another one that just said, thank you so much. As is our custom, the third Wednesday of each month, other than July and August, we do this series, Let's Talk About Health, and next month will be Healthy Aging. So do come back, and if you've received an invitation today, you will automatically get an invitation for next month. But do feel free to go to the ums.org/let's talk site and take a look at any of these if you would like. And with that, I want to say thank you all for joining us, and a very special thank you to you, Dr. Knoll, for all that you've done this morning. Thank you.